Chlamydia is a very common sexually transmitted organism. It's not a bacteria, it's not a virus, it's a strange organism somewhere between the two. It's passed sexually. It's of extremely high prevalence in sexually active populations, particularly in young populations. But we are also seeing more chlamydia in men and women in their 40s than we've seen previously in the UK.
In fact, chlamydia is the most commonly diagnosed bacterial sexually transmitted disease in the UK. In 2005, over 109,000 cases were diagnosed in genito-urinary medicine clinics up and down the country. This incidence is highest in women in the 16 to 24 age group and men aged 18 to 29, but the vast majority of cases go undetected.
Although it can give quite a mild illness, and in many cases no symptoms at all, it can be very damaging to a woman's fertility because it can cause scarring of her pelvis and distortion of her tubes and blockage of her tubes. And certainly it's one of the growing causes for subfertility problems in young couples.
The damage to the fallopian tubes caused by chlamydia can lead to ectopic pregnancies, where the pregnancy grows in the fallopian tube.
You see all the stuff in the media about chlamydia rising, the rates of chlamydia rising, young girls developing chlamydia, not knowing they're at really high risk of sort of developing an ectopic because the fallopian tubes are really delicate, they're very delicate little tubes with lots of little hairs which waft the egg down, and if they're damaged in any way, it can cause ectopic pregnancy because you haven't got those delicate hairs wafting the egg down and the fertilised egg down to the uterus.
Chlamydia is of growing concern, but there is help available.
There's a national screening programme for chlamydia, and as well as being screened in various family planning clinics, various sexual health clinics, there's also opportunistic screening within maternity services and gynaecology services.
So, if you're at all concerned about chlamydia, you can contact your local genito-urinary medicine clinic.